Kilter.
How are you doing?
I'm good.
All right. Can you advise any contact with anyone that is certified with COVID?
No, ma'am.
And do you report any symptoms of COVID?
No, ma'am. Alrighty. So that's Rachel. Who is that?
Huh?
Oh, sorry.
We'll get started in just a little bit, guys.
Nobody needs to see that. Happy birthday, Teresa.
Yes, happy birthday, Teresa.
Thank you. Feels good to be 25 again.
Rachel, I'm going to go ahead and start sharing my screen.
That sounds great.
Hey, Rachel, Kelsey, it's Nicole.
Hey, Nicole.
Hi there.
How are you?
Good, how are you?
Good, thanks. Hey, just wondering if I need to be a part of the training or if I can.
You know what? How about this? If you've got something that's going on, you can pop off. And I think for the most part, unless folks are thinking they might have questions about street outreach next week, I think that we'll just send you the recording and you can check it out later for your needs.
Okay, awesome. Thank you so much.
Yep. Thank you.
Yeah, thank you. Kelsey, we were coming off of another like 5-hour-long Zoom meeting, so if we need to get started without Sal, I think that's okay. I'll make sure he gets here before.
Okay. Oh, there he is.
There he is. Just letting everybody know, if you could keep yourself on mute unless you have a question. I'm going to mute myself now if you can hear my crazy cat in the background. But I think if anybody has any questions about how to use the Zoom or anything like that, feel free to type in the chat and we'll try and answer any of your questions. But most of us have done Zoom enough by now. I think most of the hiccups are out of the way. But I will just say that the presentation will include a portion that Kelsey's going to lead, talking about paper surveys, if that's the path that you're going to utilize. And Sal will show the HMIS data entry side of things, and then we can answer questions. Ultimately, you guys can decide what works best for you when you're doing your outreach. And obviously, even as we're going through next week, Sal, Kelsey, and myself are all here to answer questions throughout next week as well, and this week, of course. So thank you. I'll kick it over to Kelsey.
Great. Thank you so much, Rachel. So for those of you who don't know me, my name is Kelsey Stringham Marquis, and I'm the research partner for the annual PIT count this year. I'm really excited to be able to do the PIT count even in this time of like chaos and uncertainty and pandemic and strange political reality that we live in. So thank you all for being here. I just wanted to talk a little bit because, as I'm sure you know or can imagine, the pit count this year is going to be a little bit different than it usually is. So some big changes that I wanted to make sure everybody's on the same page about in terms of the pit count is that we are not using volunteers this year. We're really relying on PBSO and FBSO. And I just want to really express my gratitude for everyone who's helping out with the pit this year. The official day of the count is going to be Monday, January 18th. But one of the ways that the pit count is going to be different this year is that it's going to be we're going to do the count for a whole 5 days. So we'll be doing count activities during your normal outreach shifts during that entire week from the 18th all the way through the 22nd. But it's important to know that that official day is the 18th, and I will get to why in just a minute. We're also doing a mini survey instead of the full survey, and that is really to limit the amount of time that it takes to do the survey, the amount of time that you're needing to be in conversation with people, and really only limiting it to the questions that we absolutely need to know. The other thing that's different this year, as Rachel mentioned, is there's an option to use HMIS as a tool to conduct the count. And Sal is going to talk more about that after I am done talking about like the mini survey part. So really important notes that I just really want to emphasize before we get any further is our goal is to do our best. You know, we understand that like this is a crazy time and things are not going to be perfect. We're just going to try and do our best. It's still important to try to get information about people experiencing unsheltered homelessness. I think maybe particularly because of stuff with COVID and the pandemic. But we know we're not going to get like some absolute perfect count. We're just going to do the best we can. And so as part of that, it's really important for me to communicate that since you're doing the count during your normal outreach work, you may encounter a crisis that you have to deal with someone you encounter on outreach. And I want you to know that prioritize any crises or anything like that. I want that to be prioritized over doing pit activities. So if you're planning to do count activities and then your entire like time on outreach gets sucked up responding to a crisis, that's okay. I just want to make sure that we're communicating about that and let us know if that happened so we can try to mitigate that or try and send somebody else out or just know that that happened. And so we'll know when we get all the count back, we'll know that that will help us interpret what we can see in terms of the count. So today we're going to talk about logistics for the week of the count, so January 18th through the 22nd. I'm going to train you on using the mini paper survey, and then Sal's going to talk about using HMIS to complete the pit count. So some logistic stuff that I want to go over. At the beginning of your outreach shift, you're going to go to Horizon House and there will be a pit packet, a manila envelope, and inside that envelope will be around 20 surveys per shift. I will have more, there will be more available if you need more, but based on when we've done count activities before, no single group has encountered more than 20 folks. If I get feedback from you all and say, when I go out, I tend to run into like 50 people, cool, let me know and I can put more surveys in there. But to start with, we're going to start with 20 for each packet. There will be an info sheet or a cheat sheet that covers some of the information I'm going to talk about today. Importantly, it will also have my phone number, so you can call or text me if you run into any problems or if you have any questions during the week of the pit count. And there will also be some items to distribute to people you encounter. And I don't want to say for sure what those would be because I want to wait and before we confirm for sure that we have the stuff.
We can talk about at the end of the call, Kelsey.
Okay, cool, great. So When you are done with your shift, you can come back and return the surveys to Horizon House, or if for some reason that's not convenient or feasible, you can contact me to arrange a pickup with me, and I can come out or arrange a time to meet you and get the surveys from you. So we have some flexibility there. You know, we're trying to make things be as easy on outreach folks as possible. And then I just want to emphasize, you know, don't hesitate to call or text me. You're going to have my phone number. I give it out to all of you for a reason, because I want that communication. If there's any question, any concern, please go ahead and use my phone number. That's why I give it to you. So in terms of the mini survey, there are kind of, the first thing I want to talk about is when do you know to use the mini survey versus HMIS? So this year you have a choice to use HMIS or use the mini survey. But even if you use HMIS, you may still have to use the mini survey in case you encounter someone who is not already in HMIS. Now, I know that a lot of times outreach folks already have a relationship with folks on the street. So you might encounter someone and you know for sure that that person is in HMIS because you've entered services for them before. So you don't have to worry about doing the mini survey for that person. But if you encounter someone that is new to you, you've never encountered, or maybe you're not sure if that person is in HMIS, I would say go ahead and do a mini survey just to make sure we're capturing that person. The other reason you might use the mini survey is if you know for sure that you're not going to use HMIS. You don't have access to HMIS, or maybe you don't feel comfortable using HMIS to do the count activities. And you can make that decision after I talk and Sal talks today through this training. But that would be another reason. And if that's the case, then you're going to need to complete a mini survey for everybody that you encounter while you're on outreach. So on the mini survey, there are going to be like a few different groups of questions, and I'm going to talk through those just a little bit. The first thing you're going to need to put on there is the date when you are completing the survey. So whether that's the 18th or the 20th or the 22nd, put the day that you encounter the person, put that on the survey. I want your name. That's super important because last year there were some surveys that once we got them back, we had some questions about. It was so helpful for me to have the names on there so that I could reach back out to the person who completed the survey, you know, and clarify, hey, like it looked like you marked this, but I wasn't really sure. So being able to know who did the survey is really helpful on the back end in case we have any questions. There'll be a spot for you to put location. Really, I'm just looking for, you know, it doesn't have to be a super specific location. Nearest cross streets, general location, you know, if it's a particular camp, you can put the name of that camp, that's fine. But just so we have an idea of where geographically you are when you're doing this survey. Then there you'll see a little bit of a script, and that's just to help you think about, you know, what do you say to someone when you're asking them to participate, or how do you describe what we're doing? So that's just a little bit of language that you can use if you are wanting some assistance in how to talk about the pit. Then the first thing you'll see, the very first question is the consent to participate, particularly if this is someone who is new to you and who is not in HMIS, but really for anybody, that consent to participate, that has to be filled in. That was something that happened last year, is sometimes that consent was blank. And so I, you know, as the researcher on the back end, I couldn't be sure whether or not that person had consented to give their information. So make sure that you ask if it's okay, if the person wants to participate, and mark that consent to participate. The next set of questions are really like the bulk of what we're asking. So we're gonna ask, where did you stay the night of January 18th? There will be a little line where you can write it in. There's not that long list of options like there has been in the past. And really what we're looking for is, did this person stay
in a place not meant for human habitation. And we're asking because we have to determine where the person stayed on the night of January 18th, since that's the official day of the count. So even if you're interviewing someone, you're doing outreach on the 20th or the 21st, you still need to ask about the 18th. So you still need to say, hey, where did you stay on Monday night? That's the night that we're trying to measure. So even though we're asking on different days, we're trying to measure where they stayed on the night of January 18th. The next question is just, are there children with you? That's going to be a yes or no question. If the answer is yes, there's a little place to mark how many children. My guess is you will not encounter anybody who has children with them. I could be wrong about that. Last year we had 0. The year before that, I think it was less than 5 children that we encountered on the night of the pit. So I don't anticipate that is something you'll run into, but of course, if it does, we want to know if there are any families with minor children experiencing homelessness, experiencing unsheltered homelessness. The next question is going to be about whether or not the person served in the armed forces, and then we get into the demographics, right? So we want to know, does that person identify as Hispanic or Latino? How do they identify their race? And how do they identify their gender? Now, the Hispanic and Latino question and the race question, those are check boxes. You can check as many as apply. And then gender is just a line. So however the person identifies their gender, you just write in whatever they say. Those are the bulk of the questions. Then the final questions, I really want to emphasize how important they are, because these are the questions that are going to help us make sure that we don't count the same person twice. Now, we have a whole process to make sure we don't do that on the night of the count, but my guess is, since we're doing the count over multiple days and using multiple different ways to count people, we're probably going to run into counting someone more than once more often than we do on a normal year. So it's really important that we're able to get the client's initials, the client's date of birth, and then there will be a place where you can put the client track ID, so that if it's available, that would be so helpful to us in making sure that we're not counting the same person twice. If you're not going to use HMIS at all, there's no way that you would know that, so that's okay. But I'm really thinking about, if you access HMIS sometimes and you encounter someone, you're not sure if they're in HMIS, so you do a paper survey, and then you go back to your office to enter your notes from outreach or enter your services from outreach, and you find that person in HMIS. If you can pull their client track ID and write it down for us on the survey, that's going to be super, super helpful in making sure that we don't count the same person more than once. So that's kind of the overview of the survey. It will look something like this. It'll be a half sheet of paper. So this is probably about what it's going to look like. I might move a couple things around just for formatting purposes. But this is what you're probably going to see in your packets, all these little half sheets. And so this is how it's laid out. I wanted, because I'm a visual person, I wanted to give you a chance to be able to see what it looks like before you get to it. So that's my very brief, very quick training on the survey. I would love to take questions if you have questions about the paper survey, or I can wait until the end and take more questions at the very end if you have them.
I do want to acknowledge a question that Amanda put in the chat.
Sure.
The question is, what do we prefer people do, the mini survey or HMIS? And I don't want to speak on behalf of you or Sal as our research experts and HMIS experts here. So I'll let you and Sal kind of explain our preference. But I will just say, just to be clear, if you are choosing to do one or the other, that is great. So I don't want anyone, and I know Kelsey and Sal agree, if one of these options is more of a burden, then choose the other one.
Yeah.
We want this to be what works for you in your scenario ultimately, but I will let them talk about a preference if you guys would like to.
Yeah, I mean, I would say if you feel comfortable with HMIS and you use HMIS regularly, and after you see what Sal has to present, you know, you watch that and you're like, yep, I definitely can do that. I feel confident about that. Then that would be my preference. But as Rachel said, I want it to be what is most comfortable for you. And I want, you know, I want people to do whatever's going to work best, because at the end of the day, I want people to be participating in gathering the data. And Amanda, I see your question about agencies being off on Monday. That occurred to me later on. I have mostly not worked at places that have that day off, but that is a very valid question, and thank you for asking it, Amanda. I don't know if Rachel has any input on that.
So as far as I understand, there will still be folks going out on Monday. Yeah. Yes, I know that there will be some folks that are not going to be working that day. I think we can still ask about that day, because I know none of our providers are we're not completely shut down that day. Folks will obviously still be experiencing homelessness that day. You know, folks like Wheeler Mission and our other major shelters will be taking people that night, obviously. We believe that with the coverage we're getting on the additional days that week, we can address the concern about maybe not having 100% coverage that day on street outreach with the other days that we're using. Just for transparency's sake, the reason why we selected the 18th was because in the past, when we have conducted the pit count during the very last week of January, we have come across issues related to weather that were pretty prohibitive, and then we were stuck essentially with no alternative but to have the pit count, even in some pretty horrible circumstances, as some of you may remember. And then when we began going down the path of a multi-day survey, it just made the most sense to ask people about a day either that night or a day in the past, as opposed to saying, for example, hey, where are you going to stay on Thursday night? So we know that this is, you know, it's imperfect, but we think it's the best that we are able to do given all of the many circumstances going on. And we've received permission from HUD. We have received our HUD approval that our methodology is acceptable and that our data will be accepted by HUD when we submit it. So we absolutely recognize the challenge of it being Martin Luther King Day and some folks being off. But we believe we've got the coverage we need and we've gotten the approval to make sure it's correct.
Any other questions? Also, no pressure. If you want to think about it and you have questions after Sal talks, I'm happy to answer questions at that point as well.
I just have a clarifying question to Sal and Kelsey here too. If I am going out on street outreach and I'm not sure if someone has been surveyed or counted that week, what should I do?
If you are not sure if that person has already been counted, then you need to count them. Yeah, I'd rather, because we have planned for the fact that we know that people are going to get double counted, right? So we already know that that's going to happen. We have a plan for that to make sure that on the back end, we're only counting everybody once. But what I would hate is we miss somebody because, you know, you thought maybe that they had already been counted. So I'd rather count somebody more than once than not get them at all.
Yeah, thanks, Sal. Or thanks, Kelsey. Sal, what were you gonna say?
No, I was about to say that's a great point. In HMIS, you can see if they've already been counted for the 18th, and I'll show people how to look that up, but that's only going to be applicable to those clients that have enrollments in HMIS. But I'll get into it when I start presenting on the HMIS side of things. So if you want to finish your point, Rachel.
Kelsey, what if I am talking to someone, I'm using the survey because either that's what I've chosen to do for all of my contacts, or I am not sure. What if they don't want to talk to me and they refuse?
You can mark, I would still put the date, your location and your name, and say, on the survey, put refused, or put, there's that consent question, and you can mark no, because that will at least tell me that you encountered somebody, but that they didn't want to participate. So that they weren't going to answer all those questions, but that's going to be helpful to me anyway, to see that you ran into somebody.
Justin's asking about quadrants, and I'm not sure that I have a good answer for that right now. Kelsey will have me.
Yeah, I feel like, so we've talked with Nicole about it, and I think, based on our conversations with Nicole, it sounds like there is maybe like a lead person for each quadrant. And so we're going to be in communication to make sure that we're at least trying to get out to all the quadrants over the course of the week, or all of the hot spots, at least, that we know that there are people there. So and again, that's going to be a little bit different this year, because it's not systematic in the way that it has been before, because we understand, like I said earlier, Amanda might go out and she ends up encountering a crisis that takes hours, right? So all the people that she, was planning to get to aren't going to be, reached that particular day. But luckily, with doing it over multiple days, we should be able to adjust. And so my hope is, we're going to be in pretty, Amanda, we're going to be in pretty close communication all week. And that's why I'm saying, also emphasizing, please reach out, please communicate, because that's going to help us kind of respond to, what's happening on the ground during that whole week, and be flexible and adaptable, and be able to change plans if we need to really do the best we can with the count.
There's a question here. Should they add a physical description for somebody if they refuse?
Yes, you're going to put your location at the top.
What about the person's physical description? They're observing this person in some way, being a certain race, ethnicity, etc.
Yeah, we got feedback from HUD this year, which I am very pleased about, that we are no longer observing demographic characteristics. So if somebody refuses, then they refuse, and that is okay.
Thank you. The last thing I'll add before we take any more questions is there's some chat here about bus passes. So Kelsey alluded to a packet. We went back and forth about whether or not to do outreach packs after additional consideration. We're just going to provide you guys with bus passes. I think Kelsey also has masks.
Yeah, I have some PPE.
Yeah. We have some extra PPE if you want to hand that out to folks. We just realized with already handing you a packet of surveys, I know how you guys already take stuff out to so many places. Adding an additional pack of stuff, especially given how long it took us to get approval for our process, didn't seem feasible. And I knew that those bus passes were our hottest commodity anyway. So I got approval for us to purchase 300 single day bus passes. So we'll have 300. So don't go raining bus passes everywhere you go. But I hope we don't have more than 300 people out on the street. I know that we absolutely could, which breaks my heart. But we'll have 300, and we'll work with Nicole to divvy those bus passes up throughout the week so that nobody goes out with absolutely no bus passes. But hopefully that's a nice incentive for folks to interact, engage, and just be, a cherry on top of the stuff you guys already give out every day, which is obviously amazing. So that's kind of what we decided.
Hey everybody, this is Scott. I'm sorry I was late to the party. I hate to be late to parties, believe me. But hey, I was wondering. So on basically, it's going to be over the whole week, and but then like Teresa and I, for instance, go out on Tuesdays. That's when we would do our count. Is that correct? Because I know Adult and Child is off on Monday, and then will we pick up the packets from Horizon House prior? Because we start late on Tuesday.
Yeah, so I would say at the beginning, like right before you go out or sometime before you go out, to swing by Horizon House and pick up the packet. I'm going to drop the packets off at Horizon House on the Friday before. So that's when they'll be ready to go. But yeah, so if you're going to go out on Tuesday, you know, swing by Horizon House first, pick up your packet, and then, you know, I just want to make sure you're still going to be asking when you encounter people, you're going to be asking where they stayed on Monday night, even if you're going out on Tuesday.
So if I'm planning on doing my questioning or a record in HMIS, do I have to come by to pick up packets?
Yes, because it's possible you might encounter someone who is not in HMIS, and I want everybody to have the surveys with them just in case that happens.
But it would be easy to enter someone into HMIS, right? I mean, it takes...
Correct, Scott. We would enter someone. If we met someone and we didn't know, we would then enter them in HMIS.
Yeah.
Yeah, folks. I mean, if you want to do the full enrollment, and we're talking about, you know, having the race, maybe you don't get to the income, maybe you don't get to non-cash benefits or health insurance, but if you can get the basic demographics down and you're willing to do an enrollment for that person, that's specifically what I'll be talking about. And actually, I feel, is this a good
Yeah,
segue?
I think, why don't you go ahead and do your training, and then if people have questions for the whole process after you're done, I'm thinking now we're probably getting into questions that are going to be answered by your training. So go for it.
So when we were designing this training, let me see, can everyone see my screen? Yes, all right, perfect. So the process for documenting for sort of flagging a client in HMIS is that we're going to look for clients that have an enrollment into an outreach project. And so an enrollment is not a service. I know that the practice in the community has been that you know, on first contact, all you'll do is document a service. We need an enrollment, a full enrollment. So an enrollment looks something like this. Here I am on my client's record, fig sample. And I can see that under this street outreach category, they're in my coordinated entry project. And so I can go through that coordinated entry project, and effectively, I'm not going to go through it here, but at this point, all this information should be filled out. We have their name, their SSN, if they give us an SSN, their date of birth. Again, if they give us a date of birth. Here I have a client who just gave us, you know, they might have told us I was born on December and I'm 30 years old. So we could approximate that. So this is where we want to start building out the client's demographics. And sorry, we're loading a little bit. Most of the clients that I'm assuming you're going to be encountering are going to be folks that are single. They're not going to be attached with anyone. So most of the enrollments will have this as well. So we'll just keep moving forward. And then this project start date, again, these are all things that y'all have been trained on, I hope and believe, just to enroll a client into your coordinated entry, coordinated outreach project, or just your outreach project in general. And so then at this point, we get into, you know, the health insurance, their prior living situation, etc. I'm going to forego that. That's the basics of doing a full enrollment for a client. So I'll cancel this workflow. So again, your client should have an enrollment, and if it's someone that you encounter that is new and you're able to get the demographic information, enroll them into HMIS, and that enrollment date will likely be on the, on the 18th or whenever you encounter that person. But what we're going to be looking at, the trigger that we're going to be looking at for that client's information is their current living situation as of the night of January 18th. And so again, you have an entire week to enter this. From Monday through Friday, we're going to be looking for current living situations that are attached with outreach enrollments, and those current living situation records have an information date of January 18th. Let me show you what that looks like. So this client, they're already enrolled in our project. And over here in this sidebar, I'm gonna go ahead and under this blue profile, you'll see current living situation. I want to make it a point that current living situation is not extra work for you. You're gonna be killing two birds with one stone. You're going to be documenting what you need for the PIT, but also it's going to count as a contact. So your usual workload that you have to have in documenting contacts that you had with the client, this is already fulfilling that. So you don't have to go back and do your regular data entry because you've already fulfilled it doing this. All right, so we are at the current living situation screen. I'm going to go right up here to my upper right-hand corner, click on Add New Current Living Situation. And this is important. So let's pretend that today is supposed to be 11/20/2021. I encountered a client on my count on Wednesday, 2 days after the point in time count. The information date should be set to 11/18 because I will ask my client, well, on the night of Monday, on the night of January 18th, where were you sleeping? And so you'll select January 18th for this. The enrollment, you have to attach it to an enrollment, which is why it's important to enroll your clients into, here I'm someone that's working with coordinated outreach, but if you're adult and child, or if you have your own outreach project at your particular agency, you'll select that one. So I'm attaching this to coordinated outreach. And then the current living situation, I'll click the drop down. What is going to be flagged for us as a client that's unsheltered is if they are in a place not meant for habitation. So places not meant for habitation, those include they're sleeping, they're sleeping in the park, they're sleeping on the sidewalk, on vents, but then it also includes
what that means.
Sorry, say that again. The person that spoke came in very
I think it was an accident.
Okay. Yeah, so place not meant for human habitation, that means that it's someone sleeping on a park, the streets, but it also means if they're sleeping in a car, if they're sleeping in an abandoned house or a condemned house, those all count as places not meant for human habitation. So it's not just that they're sleeping, or if they're sleeping on public transit, spending the night on the bus, the train, whatever it may be. So that's what we're looking for. So if, let's say the client said that, yes, on Monday I was here in my encampment, you'll go ahead and select that. Location detail, go ahead and enter where that encampment might have been at, what quadrant it might have been in. This is where you're able to add whatever details you need. And that'll sort of help us after the fact, once we do the basic HUD portion of what we need to do, we can look back at this data and start to see how some of the encampments are forming, find out which new encampments are around that were never there before. So you really want to use location detail to show, maybe you put an intersection, something of that sort. And so here's where we'll be able to kill the two birds with the one stone. If you click on record contact, now it's asked for a contact service. I'll say that it is CO Outreach Encounter. Y'all will have different contact services for those clients. So I'll select this. And again, I can add whatever comment. but then the final thing is to make sure this is restrict to MOU/info release. That means that everyone can see it. And that's going to be important because as we're inputting data for this person, you know, adult and child might have gotten to somebody on Tuesday and they might have entered where they were that night. So the day after, if Horizon House does outreach and encounters the same person, I'm going to go ahead and click save. When Horizon House comes to this screen, they're able to see that, yes, information date. So they'll be able to say, there's already an information date for Monday. So I think we're good. We don't need to follow up with this person or anything of that sort. And again, this created an outreach service for us. So we've already fulfilled the need for reporting, the need for updating them. This will keep them updated for coordinated outreach, etc. So it's really an effective way of fulfilling both requirements for the PIT and your general day-to-day work.
Hey, Sal.
questions? Yeah.
Sal, Amanda asked about a path enrollment. So as long as you have somebody enrolled in the project, you'll have this option when you go into current living situation to select.
Exactly.
I just need to make sure the MOU bit is checked, the correct one.
Yes, the restrict, because if
'Cause
you're
path
path,
is-
I'm assuming you're going to be restrict to organization, right?
Right, correct.
Yeah, just change that for that night, for that entry, just change it
Yeah.
over to restrict to MOU. And then going forward, you don't necessarily have to keep that practice, but just for this entry, just for
Correct.
this purpose, please do that.
Okay.
And I also have more guidance here. I sent the link in the chat, and it's a quick blow by blow of everything that I had just done, okay? So it'll be, again, you know, you won't be on the coordinated outreach enrollment. You'll probably be for your path or whatever your particular outreach project is. But these are things that you just apply your project to this and the steps will make sense. And as always, if you don't find, you know, if it's still not coming together for you and if you need more assistance, this blue button right up here, the plus new ticket, add new ticket, if you click on that, you'll be able to send a request to me and my team so that we can help assist you through this process and answer any questions that you have. So are there any concerns, anything that I need to clear up?
Our team lead has informed me that we're doing ours on paper, and I agree.
Great.
That's your prerogative, as
Yeah.
they say.
Do we have to come to Horizon House to pick up? I mean, in the packets is literally just these sheets of paper and some pencils, pens.
So it'll be a sheet with like a cheat sheet, an info sheet with my information, so you can get in contact with me. There'll be copies of the survey, some pencils. Sounds like also there will be bus passes available and masks or other PPE if you want to have those with you to distribute when you go out.
Scott's down with PPE.
Very much so. I get very excited about it. You weren't supposed to tell anyone about that, though.
I am referencing an old-timey song that you probably don't know. That's all right, Scott.
Are there any other questions that people have right now?
One thing I will just note, you'll obviously have Kelsey's information in the packet, and Sal is available via email too. Sal lives in Chicago, so he's an hour behind us. So if you're out on street outreach at 7 a.m. and you try and connect with him, he may not get to you right away because he's an hour behind. So We appreciate your patience if you're trying to connect with them with a time difference.
I will get to y'all though, okay?
I have a question.
Yeah, Teresa.
So on the quadrants, so are they going to give us, like we did last year, to where we at least have an idea of where all the camps are? Because even though I may be most familiar with the west side, that certainly doesn't mean that I know where all those camps are, because I don't, nor do I know all those people. So how's that going to work if, you know?
Yeah, that's a really good question. I think I'd like to touch base with Nicole about that. I think we talked about sending out the map with the pins again, although I know that maybe that map with the pins is not the most up to date. It could be helpful. But yeah, my inclination is to want to check with Nicole before I like fully answer that. But I don't know, Rachel, if you have anything else to add.
No, I don't think I do. We did talk about this. We felt like we had coverage over that 5 days to pretty much everywhere anyone would be. I think that's another reason why we want to stay in good communication with you all and the FBOT, because we know something might come up and somebody had an intention to get out to a certain location that day and it didn't happen. So that may mean that, we're connecting with somebody else later in the week to say, hey, no one's been out there, similar to what you guys probably already do when you're trying to make sure that everybody gets touched regularly. But we will talk to Nicole about what makes sense to send out as far as a map goes, because I think you're bringing up a good point. There may be some places that we don't get to all that often that we want to make priority to get to at least once next week. But we know, just like how when you guys already go out, you may go out somewhere and nobody's there that day. We're just going to do the best that we can, and we appreciate you guys and your help in all of that. I did want to also share that we are, the CHIP team will be covering the Poorhouse event on that Wednesday evening. So if you know folks who typically go out to that event that maybe we don't see any other place, know that we do have coverage there. And Kelsey will be working with the faith-based outreach group this week to go over the paper survey with them as well. So if you've got folks who typically only engage maybe through one avenue, we're trying to get as much coverage as we can, not just asking you all to do the surveying and not touching our other places. So I want to make sure that's clear.
So we are not necessarily responsible for quadrants. Did I hear that correctly or not?
I imagine things will get divided up, Scott. I mean, it couldn't hurt. I imagine this is just like when we were doing emergency food delivery. It would be very easy to assign areas, but I guess we have to wait and hear. I think you just have a bunch of outreach workers on here that want to ensure that everyone gets counted, and we don't mind.
Thanks, Amanda. Thank you.
Sure.
Well, we're trying to figure this out as we're flying the plane and building it too. So we didn't want to keep things too restrictive, but I also know the importance of clarity. So we'll look for some middle ground this week and communicate out to you guys if we are going down a certain kind of path. And certainly if you have concerns about coverage, lift that up to Nicole so that we make sure we address it in time. So thank you.
Yeah, and I think I'd just like to say again, just how appreciative I feel of all of you guys and your dedication to the pit and wanting to make sure that we get to everybody and that we can count everybody. I really appreciate it a lot.
Any other questions for the good of the group?
I don't see all the outreach workers on here. Are these the only people you have doing the point in time count?
The folks who can make it today, and then this recording, we're going to post on YouTube. It'll be a simple YouTube link that I already know a couple of people have already said they're going to be viewing separately. Tabby's team, for example, I know when we spoke with Tabby, she said they'd probably just get her IMPD team together and watch it separate. So if you have anybody that's on here or somebody that's not on here that you know is going out next week, feel free when this information gets to you to forward it on. I know Nicole will also be making sure everybody gets this, but hopefully with 2 sections being separated, people can kind of tailor their viewing, either the short survey section or the HMIS section, so that folks can get the information that they need. And we'll keep communicating with you all this week too to make sure we follow up on those couple of questions we didn't have answers for. Okay, well, we'll give you your 10 minutes back. 9 now at this point. Unless anybody has anything else, we'll, Sal, Kelsey, and I will stick around here. You're free to hang around and ask any other questions as people are signing off. So thank you all so much. Thank you.
Thanks, everyone.
Thanks, everyone.
Hey, just as people are logging off, I'm realizing I can take this opportunity, Sal and Rachel, to introduce you to Libby, who's my student who's going to help me on the PIT this year.
Hi, Libby.
Yes. Nice to meet you.
Nice to meet you.
I didn't see until like a couple minutes ago that I was invited to this meeting, so I thought I would just catch the end.
That's all right. I'm glad you're here. And then I'll make sure you get the link so you can see like the whole training and what we said to everybody. Because like I said, I think sometimes it's helpful when we're getting the surveys on the back end to know what people were told, and that helps us interpret what we see on the actual survey.
Yeah.
Kelsey, when you have this recording ready, are you going to put it in a Dropbox for me? Or because I noticed the recording came on, but I don't know that it's going to,
This is not my meeting. This is a meeting that you are hosting.
Oh, good. So then I must have set it to automatically record. Yay.
Yeah, I think you did.
I
I would love to help you with that, but
I was nervous. I was like, oh crap. Like she turned on the recording and I was needing to hit the record button. So, all right.
Yeah, I know. I was like, wow, Rachel's so on top of it. Like we're already recording. This is great.
Yeah. Wow. This is the extra session at the end that nobody needs to view, but it'll be
yes.
Okay, guys. Well, thank you all so much. I'll turn off the recording now that I realize
Okay.
I